So how to decide if active surveillance is right for you is a decision that has to be made between you and your doctor. So your urologist or the doctor who's managing your prostate cancer, and you have to have a long, thorough, thoughtful discussion, because the decision to watch a prostate cancer is not only based on the fact that it has to meet certain criteria of being low risk, non-aggressive, but it also has to be a shared partnership with how you're going to follow it. Because although some prostate cancers will remain low risk, many will progress and become more aggressive, and so you want to find it if that were to happen, and then you might need treatment in the future. So you have to discuss that with your doctor. Now, additionally, from the risk factors of the actual prostate cancer, there's a lot of social issues that go with surveillance. You have to be able to deal with the anxiety of not treating a cancer, and that sometimes is very difficult for men and their wives and their families to talk about, because if you're going to think about it every day, if it's something that's going to bother you on a daily basis, that is a problem. That's going to be very difficult in an active surveillance program. However, if you happen to have a personality where you realize your cancer is not lethal, it's not aggressive, it's not going to harm you, and somebody's keeping a close eye on you, and your day-to-day life is good and happy, and you can manage that, then active surveillance is an excellent option for somebody like that.
Some prostate cancers are high risk, aggressive, and more likely to spread. Others are low risk, least likely to have bad outcomes. The biopsy says cancer, but current diagnostic tools provide limited information about how aggressive a man's individual disease is. So most men decide to treat prostate cancer immediately. Once treated, many men experience serious long-term side effects, like incontinence and sexual impotence. Immediate treatment isn't always needed, but right now a man can't be sure if his cancer is the kind that is likely to require treatment, or if he's okay to wait for now. What if there was a test that could determine how aggressive prostate cancer is? Genomic Health is developing a new test to do just that. By reviewing the underlying biology of the tumor and using genes from multiple biologic pathways, the test can predict the aggressiveness of prostate cancer when diagnosed, allowing a man to make a more informed treatment decision with confidence, taking care of himself with more information and greater peace of mind.